Hey fam, welcome back to the Gilead Gazette, where Republicans keep trying to reform healthcare by seeing how fast they can strip reproductive rights before anyone finishes their morning coffee. We start with their newest trick, weaponizing health insurance to erase abortion access. The plan is simple and malicious. If your plan covers abortion, even if the state pays for that portion separately, it loses all federal subsidies immediately. Poof! Gone. Senator Ron Wyden called it exactly what it is, quote, a backdoor national abortion ban. And without subsidies, premiums shoot into the sell a kidney range until insurers drop abortion coverage just to keep plans affordable. It's not a ban, it's extortion masquerading as policy. Meanwhile, the global community is staring at us like we've lost our damn minds. The United Nations, Human Rights Watch, Amnesty International, and the Center for Reproductive Rights have all stated outright that U.S. abortion bans, especially Texas's, qualify as human rights violations under treaties the U.S. helped write. Forcing someone to stay pregnant against their will, particularly when it risks their life, meets the threshold for cruel, inhuman, and degrading treatment. And the Trump administration's response? They rewrote the State Department's human rights guidelines so that countries that protect abortion rights, LGBTQ rights, and workplace equality will now be flagged as human rights abusers. So, the UN sees women bleeding out in red state parking lots and calls it torture. The U.S. government sees countries protecting women and calls it abuse. We're not just exporting hypocrisy, we're exporting delusion. And if you think this is all abstract, South Carolina would like a word. This week, anti-abortion extremist Mark Baumgartner, a man who has spent years lurking outside Planned Parenthood with a Bible, a GoPro, and the confidence of someone who thinks harassment counts as ministry, pepper sprayed a man and then shot him. On camera. And the police? They questioned him politely and let him go home. For 11 days. It took the video going viral for them to act. Incredibly, Baumgartner's attorney told local media, quote, "We were really caught off guard. He was arrested this morning without any notice." Imagine being so used to impunity that you're surprised when you don't get away with attempted murder. Meanwhile, in the same region, a woman was jailed after a miscarriage. This is what happens when you pardon extremists, dismantle clinic protection laws, and portray doctors like they're war criminals. Violence stops being shocking and starts becoming expected. And in other red state news, lawmakers are busy working on their favorite fanfic, clarifying bills that clarify nothing. Across multiple states, Republicans are pushing laws they swear will protect women by explaining medical exceptions. In reality, they rewrite statutes so doctors can act only when a patient is one organ short of the morgue. Some bills redefine abortion so narrowly that miscarriage care, sepsis treatment, and terminating fatal pregnancies become legally dangerous. Others use language so fetus first and lawyered up that doctors are expected to wait until patients are on the brink of death before intervening. Texas passed the Life of the Mother Act, which still adds no exceptions for rape, incest, or catastrophic fetal anomalies, and leaves doctors facing 99-year prison sentences if prosecutors don't like their medical judgment. On paper, Republicans get to say, look, we clarified the rules. In hospitals, doctors are calling attorneys instead of anesthesiologists. And finally, 150 congressional Republicans sent a letter this week demanding the FDA ban telehealth access to abortion medication. Their reasoning? Mifepristone is direct, quote, baby poison. That's the medical terminology from the party that's running the FDA. They're not fixing healthcare. They're building a system where women bleed, suffer, and obey. A government rewriting medicine, law, and human rights for one purpose: to control women. They won't stop, so we damn well better not either.